Hey, everybody. Um, on June 14th, 2020, my son Theo turned 18, and the world had shut down due to the COVID pandemic. But fortunately, we had almost completed most of the paperwork for conservatorship and SSI. So for 18 months, things were okay. Then in early 2022, Theo needed VNS replacement surgery. And as he was being prepped for the procedure, an administrator walked in and asked for his conservatorship documents before they could proceed. Nobody had asked us to bring it, but thank God we had. So that moment, though, was our welcome to the adult world. So not long after that, his longtime pediatric epileptologist, who had promised us that he'd still be her patient into adulthood, told us that she was scaling back her practice and we'd have to switch to an adult provider. There was no warm handoff, no records shared, no conversation between the doctors. It was just us starting over, carrying his entire history in our heads. Now, our first visit with his new neurologist felt a little bit lukewarm, like he wasn't sure what to do with Theo. But I really couldn't accept that, so I told him that I hoped that he would maybe think about Theo once between appointments. And I wanted us to be partners instead of, caretakers of paperwork. And to his credit, he stepped up. And so the next time we saw him, he came in ready to discuss a new treatment for Theo. But sadly, through my conversations with other caregivers, that might be a rare experience for many others. And, when you're going through this transition, it's a very lonely feeling. And of course, that doesn't fix everything else that we're up against, like prior authorizations, insurance denials, medication shortages, and one of my favorites, pharmacies that don't order the medication until 1 or 2 days before you run out, so you may not get it in time, and it's a real nail biter. Every single battle falls on us, the caregivers, and there's no one else fighting for him, and it's exhausting. So now I'm going to tell you a little bit about what LGS is doing to Theo's body as he gets older. At 16, his doctor told us that he was the only one of her LGS patients who could still walk a bit, and that he'd probably lose that skill eventually. Now, fortunately, he can still walk a bit, but with a helmet on and somebody holding him steady, and outside of our home, it's a wheelchair all the time. And last year, Theo had cluster seizures that wouldn't stop, and he aspirated. And we called 911 and rushed him to the hospital, where he stayed for 4 days. And we were told that severe constipation had probably contributed to the clusters. So now we keep a chart of his bowel movements. And getting him on his feet every day isn't just about mobility anymore. It's about, keeping things moving and keeping him alive. And I really have to talk about SUDEP, because not one doctor, pediatric or adult, ever brought it up. I had to be the one to say it out loud. And I need every provider listening to hear this. Staying silent doesn't protect us. It just leaves us alone with the fear. SUDEP, aspiration pneumonia, these aren't abstract risks to me. These are what I think about every single night. Keeping my son alive is not in the background of my life. It is my life. And I'm starting to see other changes too, like his voracious appetite is kind of fading a little bit, and he retains his urine, oh God, so much. He tires more easily, and he has such a high pain tolerance. I worry that if he were in pain without a visible wound, would he even be able to indicate that to me? Because he's nonverbal and he can't tell me. LGS families have multiple specialists. They all require that warm handoff to an adult provider. Theo's constipation can trigger dangerous seizures, and I don't even know if his GI doc and his epileptologist would even talk to one another about that. So here's what I'm asking for providers. Many of you have admitted that adult epileptologists need to be doing better. Partner with your patients and their other providers. A 5-minute conversation between specialists could save a family like mine a trip to the ER. And for my fellow caregivers out there, build those partnerships with your providers. Have the difficult conversations. You know your loved one better than anybody in the room, and that knowledge only becomes more essential as he or she ages. And get others involved. Family members, siblings, friends, anybody who might become future caregivers of your loved one. Give them the warm handoff that you had hoped for in that transition phase so that they're not left to fend for themselves. And that especially applies to the siblings. Theo deserves a healthcare system and a team that fights for him as hard as I do. And so do all of the other Theos out there. And that's the world that I'm hoping we can all build together. Thank you.